I'd like to welcome you back to the show. It's always a pleasure and an honor to have Paul Seegert with us. He's managing partner of PCS Advisors. They help companies significantly reduce healthcare costs while improving healthcare benefits and plans for employees. Now I would encourage you to check them out at pcsadvisors.com. Paul, welcome back to the show.
Thank you.
So, something I learned from a piece that you sent us, and I did not know about this, is that Wall Street firms took over nursing homes, or at least this, I guess maybe this is what Biden is claiming, and the quality and service has gone down and the costs have gone up, and he says Medicare is going to set higher standards, blah, blah, blah. What do you know about that?
Well, that's an interesting take on it that he has. The reality is that the most expensive way that we can pay for healthcare in this country, and this is true at all ages, whether it's people at end of life or young people or whatever, is to have the government pay for it. The COVID testing is a perfect example. You can buy the test over in Europe for $3. We're going to get it to you for free through your insurance, and our insurance companies are going to pay $120 a pop. And so that, that immediately you have to step back and say, does that sound right? When we put subsidies in place, we expanded the subsidies for people who get on Medicaid and so on. During the pandemic, the state of emergency that we were in, it cost per person $20,000 to put them on. So when the government's involved, we do a very poor job of managing costs and for quality. We get lower quality and it costs more. So that certainly is not the whole story. And I think more private industry involved is how we get better results. In the same way that I often say, employers are fixing healthcare and health plans. Private industry will be part of the solution for the quality of care in these nursing facilities.
So let's talk about something else. So when I had shoulder surgery a number of years ago, and this was one of those things where you go to a doctor and he says, well, I think you're going to need shoulder surgery, but we need like MRI or whatever to look it over. And then if the MRI comes back, if you're more than X% tore, we do surgery. If not, we don't. Well, I'm sitting here thinking, okay, one way or another, I'm going to have to pay out of pocket costs. But if the X-ray comes back negative, I just ate the cost of the X-rays. So I'm sitting here trying to figure out, do I go do a cash price versus my insurance price? Well, as you've written about, it was really hard to find out which was which, and whether it was worth the gamble or not, because there were two different prices, whether I paid cash or insurance, that because my deductible so high, I was paying either way. Yeah. You've talked about a court case that's telling hospitals, because the lab I went to was owned by a hospital, they've got to start coughing up the details on the costs.
Right. Yeah, we're at a place today. This is crazy to me. I mean, there's so many things that you can apply the word crazy to in the way that we all pay for healthcare. But one of the few good parts of the original Affordable Care Act, one of the parts that would have actually helped us control costs and make care more affordable, was this rule where hospitals were going to be required to publish their pricing for 300 common procedures. Hospitals fought that in the courts, successfully delaying it for 11 years. January of last year, they were supposed to publish their pricing. And then proof that lobbying still works. Here we are 15 months after that, or whatever, 14 months after that. 0.5% of hospitals at the three largest chains in this country are complying with the rule. 0.5%. It's just a couple few hospitals. And overall, all hospitals in the whole country, 14. Now, ironically, some of those that are most compliant are these rural hospitals that are safety net hospitals that weren't gouging people anyway. But you have this vast majority that are not in compliance. And there's a couple reasons for that. The lobbying comment that I make is because of the fact that the fine for noncompliance at the largest hospitals is somewhere in the neighborhood of $300 a day. Just take your calculator, multiply that by 365 days, and you're going to come up with about $110,000. Who cares is really the answer. I've have hospitals as clients, hospital systems, hospital associations, and I've kind of teased them about it. So, how motivating is $300 a day? I'd say that's kind of a rounding error. And I had one CFO that gave me a great description. He said, it's not even a rounding error to us. This is budget dust. I mean, it's just irrelevant. Right. So it doesn't affect behavior in any way. And then you have HHS come out saying, hey, it's $300 a day and we're not going to enforce it. So
they specifically said that.
Yeah, we're not even going to really enforce it. So you have this grandstanding of this rule that gets rolled out, but you really have to watch after these things happen because there's so many great precedents in controlling the cost of healthcare and pharmaceutical drugs and so on. And then when you watch the implementation, they get gutted of any real consequence. And that's where we are today. And so you have cases where you can have, I was looking at a hospital. This is in Central California. It was a Sutter facility, but it could be any hospital, not to pick on them particularly. And for a heart procedure, same surgeon, same OR, same procedure, all same. Depending on the health plan, the cost was going to be anywhere from $80,000 to $540,000. Now, that wouldn't really work in other industries. We wouldn't tolerate that, but we've disempowered the American consumer by having them consume in terms of copays and deductibles that have no relation to actual cost of care. So here we are, we're still at a place where one of the biggest expenses in your life, you go and consume it and you have no idea what it costs. It's incredible.
I just like it. That's just stunning. How did we get this bad? Was it this bad? So I'm in my 60s. Was it this bad when I was young?
No.
What changed? What prompted this radical convolution of pricing and shadowy pricing, et cetera, et cetera?
Well, it's gotten far worse in the last 12 years. So the Affordable Care Act should have been called the Unaffordable Care Act. And that has made it much, much worse, where we changed the rules on insurers and told insurers, hey, every dollar in premium you get, so long as you spend 85 cents, you can keep 15 cents. They do better in that arrangement. We turned them into like a public utility or something. They do better when costs go up. So evidence of how that's influenced their behavior. So you said something earlier. It's not really insurance. I agree. It's not really insurance. All they have to do is put themselves in a debit accounting position. Next year, they're going to make sure they make up any losses they had this year plus 15% on your account. So you have this situation where years ago, they would have staffed, these insurers would have staffed one nurse for every 5,000 members to guide people through the system when they have a big health event to maximize value and minimize cost. And after these rules changed in the last 12 years, they decreased that staffing to 1 in 50,000 because they really aren't, there's no incentive to control cost anymore.
Wow.
The incentive is for cost to go up. And years ago, when you were younger, to your other comment, insurance didn't work like it does today. You might have a really high deductible plan that had catastrophic type plan, or I've got 6 brothers and sisters. My parents wrote checks for all of us. So it was a different experience because you were actually consuming something as a consumer with some visibility on cost, at least cost, maybe not quality, but you had cost information and you were able to consume it like you would other things. We've completely taken that out of the equation with consumers, and that is to our great detriment. I mean, that's the fact that you go in and spend $50 and that your health plan might be billed $7,000 is crazy.
Paul, thank you so much for being with us. We value your expertise, and folks, I hope you'll go to pcsadvisors.com to see what he can do for you. Thank you, Paul.